Good morning. My name is Kathy Bargery, and as Lynn said, I coordinate a program here at Mercy called Live Active, Live Healthy. This program came to Mercy last summer. Come on in and sit down. Before that, it was in our area through the Heritage Area Agency on Aging. That was a grant funded, and there were 3 areas in Iowa that were selected, and Lynn County was one of those. And when that money ran out, Mercy decided to sustain it and keep it around as a community program. So that's where we are today. Live Active, Live Healthy was developed at Stanford University. It is a certified, licensed, and scripted program that is audited by Stanford. So that means we can't change it. We are licensed. They're very strict. So wherever you take this program in the world, it would be the same because Stanford University requires that. It is evidence-based, which means it's been followed by patients such as yourself that have taken the program, and they follow them year after year to make sure, and they get that data back to see if they have outcomes that have shown taking this course helps them live a more active, healthy life. And the goal of the program is to teach practical living skills and to increase an individual's self-efficacy when they have a chronic disease. And what is a chronic disease? There's a lot of them out there, and they're growing every day. Arthritis, diabetes, heart disease, cancer, lung conditions, depression, and any other disease that requires what we call self-management. So I have kind of a bad knee. That's a chronic disease because I have to learn to live with it every day when I try to walk or do something. So it's not just those really big diseases that people think, but it's anything that you have to try to manage on a day-to-day basis and still keep yourself active and healthy. What is chronic disease? More than 1.7 million Americans die of a chronic condition every year. That's 7 out of 10. 80% of older adults have at least one chronic condition, and 50% have 2 and up. An individual with chronic disease usually reports significantly less productivity. They often live with less income. They feel that they accomplish less and spend more time in bed, sick, or report poor mental health. So the difference between chronic and acute. Acute would be something like appendicitis. It comes on rapidly, it has a short duration, it has an accurate diagnosis, and there's a quick way to cure it. You do surgery or whatever, and you recuperate, and you can go on, and you don't have to live with that like you would a chronic condition. Chronic, something like, say, diabetes, is gradual. It often has, usually is an indefinite duration, or it's something that we're going to have to live with for probably the rest of our life. It is uncertain. Sometimes it's hard to diagnose, and the cure is often very rare. When you have a chronic disease, how do you usually feel? You can feel tired and have a lack of energy, stressed and anxious, depressed, frustrated, and maybe deal with a lot of pain. So in this program, we deal with something called the symptom cycle, and Dorothy, who's going to talk to you in a little while, will tell you about the symptom cycle, but this would be in every class. And if you look at this, and any of you have a chronic condition, you can see that maybe if you have pain, it's going to also cause you to have tense muscles, and it's going to also cause you to be stressed and anxious or short of breath. So we work on that whole symptom cycle in this program to help you learn some skills to deal with those things. It's a very important piece of the program. And we focus on trying to help you take back control of your life. We do action planning, we do problem solving, behavior modeling, decision making, and a lot of feedback. So there's a lot of interaction within those groups of people that you can learn from each other. We also use our self-management toolbox. There's a lot of things in there that come in handy for any of us, whether we have a chronic condition or not, but we really try to focus on those in this course. We go through all of these different things like physical activity, managing fatigue, medications, better breathing, healthy eating, managing pain, communication, understanding your emotions, that's a big piece often, working with your health professional, using your mind, and problem solving. So this will come out in every class as well. It's called our toolbox. So I'm going to tell you about the workshop itself. It is called Live Active, Live Healthy, Successful Living with Chronic Conditions. Now, as you all know, or people that have a chronic disease, oftentimes they get that diagnosis, and maybe you go through rehab or whatever piece, you take your medication, and then you're told to go home and make changes in your lifestyle. Well, that's not as easy to do as people think it is. So we try to do that together in a group, and people learn and help each other. We have a lot of different, like we said, tools that we use, but that's how we try to do it. So we have a group of people that meet once a week for a 6-week period at various locations around town. We want it to be a community event, so we have had them on the east side, the west side, out of town. It is taught by 2 trained peer leaders. So Dorothy is one of those peer leaders. And to be a peer leader, it's not just that anyone can walk in and tell me they want to be a peer leader. They have to go through a screening process, and then they are trained and certified through Stanford University through a very intense 4-day training period. And they are then licensed by Stanford to conduct these workshops. So, like I said at the beginning, when you go to this workshop, and no matter who your peer leaders are, they're going to teach you exactly the same thing. To be licensed, they have to do that. And there's always 2 in every class, so everybody gets a lot of that individual attention and make sure that nothing gets missed by having those 2 peer leaders. We meet for 2.5 hours. That usually sounds like a really long time to people. It goes very fast. We have a 20-minute break in there. We have an agenda at the beginning of every class with a breakdown. Because it's so interactive, it doesn't feel like you're there for 2.5 hours. We never have anybody that's trying to jump up and get out of the room. Currently we are charging only $20 for the entire 6-week session. That is to cover the cost of this book that you get to keep. Live Active, Live Healthy. It was written by the people at Stanford that developed the program. It's a fabulous book. We have a lot of people that want to buy extras at the end of the course. You also, for part of that, you get this relaxation CD, A Time for Healing. We use this in 2 of our classes to show you how to do it. We do relaxation, breathing, mind and body management. So these 2 pieces really are what that $20 fee is for. And the goals of the workshop: we want to build everyone's self-confidence and empower them to assume a major role in maintaining their health and help manage your health condition, because like we said, self-management, we are learning more and more as you hear about electronic medical records and medical homes. Self-management is going to be the biggest key to that. Our physicians are very busy, and they're not having the time that we would like to have all of our healthcare providers spend with us. This educates you to make the most use of those visits and the time that you have with them. So we cover a broad range of skills. Who should consider the workshop? Anyone with a chronic condition, anyone that's a caregiver, a family member, as long as they're over the age of 18. We also have a lot of people that take the course that don't have a chronic condition, because they learn a lot of other skills that they can utilize in their life in a lot of different ways. And the benefits. Well, we all know you're all out here and you like to walk the mall. The benefit of physical and emotional outcomes: quality of life, reduced energy and fatigue. We usually have people report when they come through the course that they feel they've learned some new skills and they don't feel as tired and fatigued. They learn some real simple ways to exercise. Sometimes we have this vision that if we can't walk the whole mall in one day, we're not exercising. We help break that down and set some very achievable goals. We've had people who maybe walk up and down their living center for 5 minutes. That's a physical activity, and they can do it how many times a day they want, and they hadn't thought of that before. So just some real simple things. We also, like I mentioned, try to give you a better partnership with your physician, because they're busy, and if you plan to get in there and have a list of questions or whatever, that makes it a very beneficial visit. And overall, an improved health status and greater self-efficacy to take care of yourselves and maintain that independence. As I mentioned, the program came to Mercy in August of 2009. We have had 180 people go through it. We have partnered with many of our local physicians and medical providers. They're getting on board and realizing that this is a very helpful program for their patients. Like I said, we offer them in a lot of different locations in the communities, and we are one of the first in the country to have brought this program in-house. And these are the outcomes. This means that Stanford University has been studying this program. It's international, it's in Japan, it's in China, and those outcomes have shown that when people a year and 2 years and 3 years out, they have improved communication with their healthcare providers, they exercise more, they rate their health better than they did before, they are less frustrated with their self-care, and they have a decline in visits to the emergency room, which is huge in dollar amounts. So that is, in a nutshell, the program that I coordinate. And now we're going to watch a 3-minute video of Dorothy.
Push it out, push it out. Now big breath in. Suck in as deep as you can. Good job. Breathe normal. Oh, that one was
Life took an unexpected turn for Dorothy McDowell 8 years ago when she was diagnosed with a chronic disease called sarcoidosis, an inflammatory disease that can attack the tissue of any organ.
It primarily has impacted both my eyes, both my lungs, and most recently my heart.
In 2007, Dorothy learned about a workshop called Successful Living with Chronic Conditions. It's part of Mercy's Chronic Disease Self-Management Program.
One day I was reading the Gazette, opened up the Gazette one morning, and I saw an advertisement in there for the program. And as I read through the bullet points of what the class would cover, I thought, wow, that is me. There is finally something for me that I can take part in, that I can relate to, where I can be involved and learn with others who, too, were suffering with a chronic illness. So I immediately picked up the phone, I called, and I registered.
Through the program, Dorothy found support, education, and encouragement.
The purpose of the program is to bring together a group of people from a variety of different illnesses and conditions because they share so many of the same things. They share that frustration, they share that fatigue of learning to live with those diseases when they're sent home.
When you're suffering with a chronic disease, you find out it's very complex. There's a lot of twists and turns and ups and downs along your pathway. Therefore, it's very necessary to learn good self-management skills, and that is what's provided.
Dorothy has embraced the program and is using what she's learned to not only better manage her disease, but to reach out to others. She's now one of the peer leaders of the Stanford-based program sustained by Mercy in partnership with Heritage Agency on Aging. The collaborative, community-based program includes a structured 6-week course taught once a week by 2 specially trained peer leaders.
Heart disease, pulmonary disease, stroke, diabetes, arthritis, just any of those conditions, as well as on down the line that people deal with on a regular basis. And most of the time those diseases are not going to go away. And this program helps people focus on learning to manage those diseases. It does not mean that their life is over.
My passion is to educate and encourage others with a chronic illness, and what I have gained from that is more than I have given to it. It is always very rewarding.
The evidence-based results of the program are impressive. To register, call 319-398-6012, or for more information, visit mercycare.org.
As Kathy said, my name is Dorothy McDowell, and I'm going to take just the next few minutes to share with you a little bit about my personal journey of living a healthy life with a chronic illness. As we heard on the video, 8 years ago, in actually April 2002, my life took a sudden turn for the worse. One morning I woke up, my vision became extremely blurry. When I looked at lights, I saw bright, beautiful rainbow-colored halos, which were very pretty, but I knew I shouldn't be seeing them. My eyes were very painful, very red, very sensitive to light. Following that, I ended up in the next few months with frequent visits to my doctor. Started with my eye doctor. I was there sometimes as often as daily. I began putting eye drops in my eyes very frequently, both eyes. It was impacting both eyes. And sometimes those drops go in on an hourly basis. So my life basically took a big turn, and I was working at the time full-time. I was diagnosed with narrow angle glaucoma, inflamed retina, retina edema floaters, and uveitis. I found myself, as I said, with many doctor's appointments, not only with an eye doctor, but with many different doctors, and had numerous tests at the time. My eye doctor did tell me to be very in tune with my body, very aware of what was going on, because when those symptoms would reappear, I needed to see them very quickly, else I could go blind in both eyes. So I was very aware. As we were going through that first 6 months, we were going through the many tests, and during that course, I had a chest x-ray come back that was very questionable. So that followed with a CAT scan of the chest. And within a couple hours of having that CAT scan done, I was back at work and I received that phone call we all hope we never receive, but many of us do. And it was the doctor's office, and they had just told me they would like me to bring my husband and to come to the office as soon as possible. So we did. And it was at that time we were informed that they either thought I had lung cancer, lymphoma, or sarcoidosis. Things moved very quickly for me after that appointment. The very next day, I ended up in a pulmonologist's office by noon, followed by a lung biopsy. And then 2 weeks later, I was at Mayo, again, another lung biopsy. And it was at that time I was actually diagnosed at Mayo with sarcoidosis, chronic uveitis, and histoplasmosis. I don't know if anyone here has ever heard of sarcoidosis. I had never heard of it, was not aware of it until the diagnosis that day. But very briefly, sarcoidosis is an inflammatory disease. It can affect actually almost any organ of the body. What it does is it causes a heightened immunity. So what that means is each of our immune system basically is there to protect our bodies from infection and from disease. But with sarcoidosis, our immune system overreacts. Therefore, it results in damage to the body tissues, and it's wherever it wants to attack. And with me, it has primarily affected both my eyes, both my lungs, and most recently my heart. As I reflect back over these last few years, I was thinking about in what ways has sarcoidosis impacted my life? And I decided a better way to state that is, in what way has it not impacted my life? Because it has covered just about every area. It has greatly changed my life, past, present, and I'm sure it will in the future. It affects my health. It has impacted my goals. My day-to-day activity, my appearance, which is twofold. One thing is the medications and the side effects have affected the appearance. Second of all, many people with chronic illness, not just sarcoidosis, you look healthy on the outside, but pretty ugly on the inside. And we call that, what we hear so often is, but you look so good, or you don't look sick. So we call that the invisible illness. It's obviously affected my financial future and, of course, my family. Many things in life we take for granted in our busy lifestyles, and far too often that becomes our health. And I have a new understanding and thankfulness for each new day and for having the breath of life. My passion, as was stated on the video, is to encourage and educate others who are living with a chronic health condition, and to help them to understand that in our lives we just have a new normal. We have a new normal along our path, and so we want to live a healthy life on a daily basis, and you can do that with a chronic condition. You may be asking, in what ways, Dorothy, have you benefited from this program? I actually would like to take you back to the spring of 2007. And I was actually reading the Gazette one morning, and I ran across this ad. And it said, "Successful Living with Chronic Conditions Workshop. Learn how to get the most out of your life for individuals who have asthma or lung disease, arthritis, heart disease, diabetes, fibromyalgia, stroke, depression, etc. The workshop will cover, and then it has these bullet points: dealing with frustration, anger, fear, and isolation, effectively communicating with your family, friends, and healthcare team, reducing stress and anxiety, safe and easy exercising, better breathing, and how to fight tiredness." That was me. Bullet point after bullet point after bullet point. And I was so excited because I felt like there was finally something for me, something where I could go, interact with others, be educated, and just have that interaction with someone else that was too walking along a path that I was walking on. So I immediately picked up the phone, I called, and I registered for the class, but little did I know that day the impact that this program, as well as the leadership and the participants that were in the workshop that I took part in, the impact that they would have on my life. Managing a chronic illness is a very complex undertaking. We have many twists and turns and ups and downs and challenges on our path. And so it makes it very important for us to have good self-management skills and to be good self-managers. So one of the first things we had covered in our class was that we have a choice. Dorothy, you have a choice. I can either choose to actively manage my illness, or I can choose to do nothing at all. But I am making a choice. And if I want to choose to actively manage it, I will look at proper exercise, good nutrition, relaxation techniques, positive self-talk. When those negative thoughts come into the mind, it's so important to turn that tape off and to switch that tape and feed yourself positive self-talk. It's important to stay informed, and that's to stay informed on your illness, to stay informed on research, to stay informed on medications. Reason being for that, one, is especially important for me, because with sarcoidosis, they still do not know the cause or the causes. And so it's ongoing research. So it's very important to stay informed on your illness and on any medications or research that is going on. Also, good documentation for your healthcare provider. Many of us have 8, 9, 10, 11 different physicians. They don't have the time to interact with one another. So it's important for us to be that glue and make sure the right hand knows what the left hand is doing. So good documentation is very important. So I had a choice. As Kathy shared, we also talked about the difference between acute illness and chronic illness, which was really good for me to see that comparison and to have an understanding, which it did. It gave me a better understanding of what life would be like living with a chronic illness, as well, again, as the importance of partnering with the healthcare provider. It also made me aware that I am the only person that can manage my illness on a day-to-day basis, which is very important. So the education and tools that were provided throughout this workshop have helped me to be better informed, to live a more productive lifestyle, and probably one of the most challenging for me was to learn to accept my limitations. So another thing that we covered is, as Kathy mentioned, the symptom cycle. With the symptom cycle here, you can see numerous symptoms that when you have a chronic illness, you may be experiencing. And many people assume that when you experience pain or shortness of breath, that is caused by your illness. That is not necessarily true. The illness can cause pain and shortness of breath, but what we have found out is that these symptoms feed off of one another. So it is twofold. So it's very important to realize that. And as an example, with depression, many times we are fatigued. With stress, many times we have tense muscles. Therefore, we may have shortness of breath and we may have pain. So by understanding that, it becomes a vicious cycle, and you need to find techniques to break that cycle and help you to manage each of those symptoms that you're experiencing. And by understanding that, it will help you to have a more productive lifestyle, obviously. The techniques that can help us in breaking that cycle are what we find in our self-management toolbox. And each of these tools we cover in the 6-week course. And we're not going to go through the tools today, but I would like to highlight the 3 that I have practiced and probably have benefited me the most, which is physical activity, better breathing, and then working with my healthcare professionals. First of all, with the physical activity, as you know, you're mall walkers, physical activity is good for all of us. For Dorothy, physical activity is a must. It is a must in my life. Prior to my illness, I was very physically active. I've always worked out. I was a runner. I was an aerobic instructor. I was not a person that ever thought I would be experiencing a chronic illness. But physical activity today is a must in my life. 3 kinds of physical activities which all work together and all are great for us are flexibility activities, which is your stretching, strengthening activities, which usually works your muscles harder. There's resistance. It could be weights, it could be bands, however you do that. And then obviously your aerobic activities, which include your walking, your mall walkers. I walk. It could be biking, it could be swimming, it could be dancing, but aerobic activities are something that basically work your entire body. All are very good for us, and one thing neat about your flexibility and your strengthening activities are they help with balance and coordination. And as we age, that's a good point. So a lot of benefits from our exercise. The second tool that has benefited me obviously the most is better breathing. And in the course of the class, we talk about the different reasons for shortness of breath. And then we also practice techniques. And some of those techniques I actually use on a daily basis still today. So that was very beneficial for me. And then third is what we call take part, but it's working with our healthcare professional. And taking part is, P is for prepare, A is ask, R is repeat, and T stands for take action. And you need to prepare for your doctor's appointments. I have found out that the appointments that I do not prepare for, I usually walk out that door very frustrated with the same questions I walked into that appointment with. So I always have a notebook with me that I keep track of my doctor's appointments. And in that, what you need to do in preparation is keep track of your symptoms. What are you experiencing? How are you feeling? And what are you doing to manage that? And is it effective or is it not effective? And then you need to report that to your doctor, what you are doing. And then with listing, you want to list your main concerns or questions. Oftentimes that doctor, they were very busy, and they also have the insurance companies breathing down their back. So they usually only have time for 2 or 3 questions. If you have more than that, I would print them on the sheet. I would give them to the doctor. I would let them look at it so they could see what your interests are, what your concerns are, and then they'll answer the ones that are most urgent. We also need to ask questions. Ask questions about your diagnosis. Ask questions about your test, your treatments, any follow-up. That's very important. And then repeat. Repeat back to the provider. Maybe they're changing a medication that day, or maybe it's your diagnosis. Repeat that back to them. The importance of that is that gives time to clarify if there's been any miscommunication or any misunderstanding. So repeat back the pertinent points of that visit. And then take action by following their recommendation. Excuse me, sorry about that. A couple other things I have done to prepare for my appointments is I always have on me the list of my medications, always, everywhere I go, this is with me. It not only lists my medications, it lists the dose, it lists how often I take it, so they know when I take it, and it lists the doctor that prescribed it for me. On that list, I also include anything I cannot take, and that's very important, as well as any health supplements that I take. Doctors need to know everything we are taking, and even your dentist. Many people don't realize, but that's very valuable. Your dentist also needs to be clued in. So that list is on me at all times. Also, my list of physicians. I not only list my physicians, but I list their expertise, and I list their address, their phone number, and their fax, So if anyone ever needs to get a hold, I have it right there. And I have a copy of previous surgeries. So that saves a lot of time when you go to a new doctor. You can just put "see attached" and give them a copy. So be prepared. And last but not least, one of my greatest joys of being involved with the program has been to be a member of what I call the Lunch Bunch. Back again in spring of 2007, I took the course, and 10 of us finished the session together, the workshop, and 9 of us still meet on a monthly basis, which has just been awesome. One of the first things we did is we chose our name, the Lunch Bunch, because we meet for lunch. The first time we went to a restaurant, none of us, we weren't that familiar with each other, and none of us knew what to say, and we did want to be known as the Chronic Illness Group. So we became the Lunch Bunch around town. Also, a couple of the gals in the class were good self-managers. They took it upon themselves to do a class directory, and they also took it upon themselves to do a phone tree, which is the pertinent information that we wanted on there. So it's really neat, because if anything takes place throughout the course of the month between our lunches, we can pick up the phone and make one phone call, and everyone in the Lunch Bunch knows what's going on for you, and they're great encouragers. It's a very positive experience for me. As a member of the Lunch Bunch 3 years later, we still are encouraging one another. We're supportive of one another. We have accountability with one another, and we truly are a family. So thank you so much for your attentiveness and allowing me to share with you today.